In this recording, I'll be discussing physical abuse during pregnancy. It's a very difficult topic to talk about, yet it's an important one. Most people are unaware of the enormity of the problem, but during pregnancy is actually a high-risk time for this to occur. Whether it's called domestic violence, intimate partner violence, battering, being in an abusive relationship, it all refers to a pattern of behavior used by someone to establish power and control over another person through fear, intimidation, and the threat or actual use of violence. It's interesting that during a time that you would think a woman would be more safe and more protected, such as during pregnancy, she's actually at greater risk than other times in her life. There's many types of abuse: physical abuse, sexual, verbal, emotional, financial abuse, and stalking. But all of these are types of behavior used to establish power and control. In the U.S., about 4 to 8 million women are battered each year by their partners. That's about 1 in 4 women who have been physically or sexually abused by an intimate partner. In Colorado, 1 in 2 women who are murdered have been killed by their intimate partner. So 50% of murders are actual cases of domestic violence. It's the most common source of injury in women, even more than car accidents. And there is no typical abused woman. It occurs across all socioeconomic groups, whether from high school dropouts to people with PhDs, from all backgrounds, both genders, different incomes. We see it across the board. It's not always seen in women of higher socioeconomic groups because women who have financial means often have places to go to escape. So abuse may be readily observed or it might be well hidden, but it's out there. Pregnancy is a higher risk time for physical abuse. 25% of women who are abused are pregnant, and 40% of abuse actually begins during pregnancy. There is an especially high rate of abuse during the first year postpartum. So even if it doesn't start up during the pregnancy, during that first year afterwards is still considered high risk. Targets of choice in pregnancy are the woman's head, her breasts, abdomen, and genitalia, but also head banging, hair pulling, and kicking are also common. So the effects of the abuse during pregnancy doesn't just affect the woman, but there's also adverse reactions or outcomes for the pregnancy and the baby as well. There's an increased risk of spontaneous abortions or miscarriages, increase in fetal demise, and a higher neonatal death rate as well. There's a higher incidence of preterm or very preterm or low birth weight babies as well. Higher risk of depression in these women, and they tend to have a higher incidence of smoking, drug, and alcohol use. Probably these are ways for them to try to cope with a bad situation. There's been more and more research on the effects to the neonate if the partner is abusive, and what they're seeing is an increase in irritability. These babies startle easier, they have a lack of responsiveness to normal stimuli, failure to thrive, and developmental delays as well. The psychology behind intimate violence is the need to have power, and to try to gain that power by grabbing power over somebody else. When a person who is abusive feels powerless, they try to regain it by victimizing somebody else. And a time that that a partner may feel more powerless is during a pregnancy, and so they work harder to try to regain some control. So the first thing in understanding abuse is understanding the cycle of violence. And there are 3 distinct phases in an abusive relationship that occur. And they don't all necessarily, these 3 different phases don't all necessarily have to occur, but they are what we typically see. So the first phase is called escalation. And during this time, there's an increase in tension and anger in the household, maybe more arguing. Often the woman feels that it's her job to keep the peace, and that if she fails and there's abuse that occurs, it's her own fault, and she needs to just try harder. She walks on eggshells during this time, and tries to keep things under control, but of course that's usually impossible. And the next phase in the cycle is what's called the explosion, and that's when the acute battering occurs. Usually when this has happened and it's over, she'll say that she feels lucky that it's not worse. She doesn't say that was horrible. She says, I'm lucky, it could have been worse. She may deny the severity of it or the need to get help, or she may not get help because she feels humiliated. How could she let that happen? She knows better. The third phase is called the honeymoon phase. After the abuse has occurred, the abuser may become remorseful, may calm down and say that they feel horrible, it won't happen again, why did she make him do that? They try to justify it. Sometimes the honeymoon stage is short. It may be a while before escalation happens again, but the more time that goes by with the physical abuse, the cycles tend to get shorter or shorter, and the abuse can occur with an absence of escalation, so there's no anger, it just occurs, and there may not be any honeymoon stage or period of remorse. It may just go from explosion to explosion. After this happens, the woman may think that may want to think that he can change. They feel responsible for the partner's well-being. They think, well, if I leave, what will he do without me? He really does love me. He knows what he did was wrong. He's just disrespectful. Or they want to save the marriage, quote unquote. And so they have difficulty leaving well, it's more complicated than that. There's many reasons they have difficulty leaving the situation. So as I said, the physical abuse can occur outside of this cycle, where there's not even any lead up and there's no honeymoon period. So what are we looking for? Knowing that this is a high-risk time during pregnancy, we need to be considering it when we see women during prenatal visits. So some of the things that we may see in the history of them coming to get care, that could be an indicator are frequently missed appointments. They have appointments to come in and they miss them and call and try to reschedule. Frequent phone calls. Frequent phone calls to their healthcare provider's office with vague complaints. They say, I'm just not feeling well, I'm not feeling right, I just want to make sure everything's all right. They don't really say why it is that they're asking those things. They also may have frequent physical symptoms that are vague and, without any obvious cause. They'll complain of nausea or stomach aches, headaches, back pain, insomnia. Any of those things can happen with pregnancy anyways, but you are kind of looking at the big picture, and if you see a pattern of clues, you want to pay attention. They may be withdrawn, with a flat affect, apathetic. They are women who don't have the usual questions about pregnancy, asking about what's going on with the baby and what are they going to experience next. They don't have questions because they're not used to questioning authority. They're used to keeping their questions to themselves. And often they have late entry to prenatal care as well. They don't get care right away because they often will hide the pregnancy for a while, or their partner may not allow them to come in and get prenatal care until the pregnancy is more obvious. Physical findings are injuries to the woman's head, her upper arms, her abdomen, her breasts, her genitalia, areas that you normally wouldn't see injuries to. And like with physical abuse or child abuse, you may see multiple injuries in various stages of healing. When asking their health history, they may have a history of vague GI problems, anorexia, a history of fractures and trauma injuries, a history of frequent accidents or visits to the ER, substance abuse, suicide attempts, refusal of hospitalization. They come through the ER and when it's suggested that they may be admitted, they refuse. They may have a history of miscarriages or therapeutic abortions, and a history of depression. So again, these aren't necessarily indicators that they've been abused. These things can happen for other reasons, but in looking at the whole picture, if there's a pattern, these might be clues to look for. Often, abused women don't see it as abuse. If they grew up in a home with violence, they may believe that that's just the way things are, or that something that they did caused the problem. It's a normal part of life to them, and they don't see it as abnormal. They complain of vague marital and relationship problems instead of saying, I'm abused. They'll say, he's been under a lot of stress lately. He's got so many responsibilities and worries. This pregnancy's coming at a bad time. He's just a demanding guy. He overreacts. He doesn't know how to be respectful. Or they'll say, I'm not a very good wife. I'm not a good housekeeper. I can't seem to keep the kids quiet. They are naughty, and I'm not good at disciplining, and they blame themselves. During prenatal visits, the significant other or the partner is usually there, and they may appear very overprotective, overly sweet. Many husbands and partners, when they come to prenatal visits, they're very protective of the pregnant woman, and that's normal. But things that you might look for are if he's not allowing her to answer for herself. He answers questions that you have for her, or he's closely monitoring what she has to say. Often he won't leave her side, or he hovers, and you have to find ways to get her aside to be able to ask her questions. Some factors that are associated with the risk for abuse in pregnancy. So certain populations are at even greater risk. Adolescents or teens, especially teens with teen partners, are at greater risk. Although it does occur across all groups, there is a greater risk in less educated women. Single women are at greater risk, and women with a presence of a coexisting medical problem or complication are also at greater risk. Again, it's probably because the situation seems more out of control to the partner. Women on public support are at greater risk, but interestingly, there is no race or ethnicity that is at higher risk than another. It occurs equally across races or across ethnicities. So, what do we do as nurses? Well, first of all, and this is very important, is there is no typical abused woman, and so we need to assess for it in all women that we take care of. And direct questions are best. So not beating around the bush, but being very frank. Some research has shown that written surveys are a good option. And sometimes women feel more comfortable being able to put it on paper rather than saying it face to face. But if you are discussing it with the woman, be prepared to look her in the eye. Use direct questions. They're best because they give her permission to admit to what's going on. Be calm, be matter of fact, keep a neutral face, and be prepared for what you're going to hear. You may hear something horrible. It's important that you isolate her from her family or her partner before you ask these questions. And one way to do that in a prenatal setting is to take her into the bathroom. Tell her that you're going to show her how to dipstick her urine, and bring her into the bathroom, leave the partner back in the exam room, and talk to her there. Be patient, wait for answers. And how do you approach that? It can be, a difficult thing to ask, but if you're very matter of fact and say, violence is a problem for many women, and especially pregnant women, and because it affects the health and well-being of them, I ask all my patients about it. Or you can say, some women tell me that their partners hit them. Has this ever happened to you? Do you feel safe at home? Is someone hurting you? Your injuries don't match what you're saying. You look like someone hit you. It's important to use words like hurt, beat, kick, punched, frightening, danger. Don't try to, candy coat the words. Speak strongly because that's what they're experiencing, and it gives them permission to use that kind of language. Obviously, if there are any injuries that you identify, you want to treat them right away. And be careful, don't get caught up in any rationalizations of hers. It's my fault, he's under a lot of stress, those kinds of things. You just need to keep saying, no one deserves to be hurt. I know, but I'm really concerned. No one deserves to be hurt. You deserve better, it's not your fault. And you repeat it like a broken record, and not let her rationalize, why it's okay that this is happening. Respect their confidentiality, and this is also important. All discussions need to occur in private, and that you build trust and ensure for her safety. Listen to her, believe what she has to say, acknowledge her feelings, and let her know that she's not alone, that many people have had similar experiences. And sometimes that's the hardest thing for these women, is believing that they will be believed, and feeling that someone will believe them. Acknowledge the injustice of it. It's not their fault. Violence towards them is not their fault, and no one deserves to be abused. Respect their autonomy and their right to make decisions in their life and when they're ready. And sometimes that's hard. We take care of a woman who is being hurt, is being abused, and she's not ready to leave that situation. We want to sometimes just grab her and take her to a safe house or call the police and have him arrested. But that's not helping the matter. She needs to regain control and power in her own life. She's the expert on her own life, and it doesn't help for us to take the decisions away from her. Oftentimes, women need to talk about it several times before they're ready to leave, many different encounters before they're ready to leave, and that's okay. We have to be patient. We have to let them take control and respect their choices. Let them know you're there for them when they're ready, and help them come up with a safety plan. The most dangerous time for a woman who's abused is when they choose to leave. Choosing to leave can cause death, and so we want to help plan for that scenario the best we can. So help them come up with a safety plan, and that can include things like putting a spare car key away somewhere, putting some money aside, a change of clothes, clothes for their kids, an extra change of clothes, financial, legal, or health records, having copies of those somewhere out of the house where they can get to them. It's good if there are kids at home that you teach them how and when to use 911 on the phone. You can come up with a code word that your a friend or a family member knows, and so that if you call them and use that code word, you know that that means, or they know that that means you need help. Like, so the code word could be, we're ordering a pizza. If you call them and say, we're ordering a pizza, do you want to come over? That means get over here quick or call the police. Okay. Know what community resources there are and promote access to them. Here in Larimer County, we have Crossroads Safe House in Fort Collins. It has a 24/7 helpline, offers 24/7 crisis intervention, has emergency shelter with good security, one-on-one advocacy, so the woman gets a specific advocate she works with through the process, free legal consultation, clothing and food assistance, and a pet foster program. And that's important. They found that one reason that women will not leave an abusive situation is because they're worried about leaving pets behind. And that may be dogs or cats, it may be horses. So having a foster program somewhere that those animals can go that's safe is important. Put posters up. I know at Poudre Valley Hospital, if you go in the public women's bathrooms, you'll see posters on the walls that talk about Crossroads Safe House. And they even recommend not just that you put them in bathrooms, but that you put them in the stalls, in the bathroom stalls themselves, because what woman wants to go in a public bathroom and start writing down the number for Crossroads Safe House when someone's watching her? So there is some places that will give women a card to put in their shoe, in their sock that they carry with them, so that they've got phone numbers and information handy. So we want to advocate that they have the assistance when they're ready for it. Know your state's mandatory reporting laws. This is Colorado Statute 1236-135. I'm not going to read it to you, but basically what it says is that if anytime we treat an injury that we have reason to believe involves a criminal act, including domestic violence, we are required to report the injury at once. So if we treat an injury that appears to be caused by a criminal act, including domestic violence, we are not required to report it when women tell us they've been abused. And that's important, and that's not true in all states. If a woman believes that if she talks to you about an abusive relationship, that means you have to report it, they're not going to feel free to talk about it. So it's important to tell them right off, if you want to talk to me about this, you need to know that I don't have to report you I don't have to report the domestic violence unless you give me permission to. If there was an injury, I would have to, obviously. Many abused women are not eager to leave a relationship. They say, I still love him. The children are better off if I stay. And with a new baby, they're worried, can they make it on their own with a baby? Sometimes they say, he'll just come after us. So, again, sometimes it takes several encounters with us or with the healthcare system before they're ready to leave a situation. And our interventions are dictated by what the woman wants to do. But we can help build her sense of empowerment and offer guidance in preparing an escape to safety. We can tell her, I think you're very brave to talk about it with me. There is help. You're not alone. But we walk next to them while they choose their own direction. If we can help, we help. But they are in charge of their own journey. We provide support. They make the decisions. And sometimes as a nurse that can be difficult. I have some graphic pictures here I want to kind of warn you about in advance, but they are illustrative of what some women go through and what they think. A very difficult topic. Before we leave, take a deep breath and let it out.